I'm going to be talking about conditioning regimens for stem cell transplant. So stem cell transplants work basically in two ways. One way they work is by allowing us to give high-intensity therapy before infusion of stem cells, but they also work through what's called an allograft effect, where the donor cells recognize the cancer as being foreign and attacks it. About 20 years ago, there began a movement to develop lower and lower intensity conditioning regimens to allow for patients who are of an older age or who have significant comorbidities to receive the life-saving potential of an allogeneic transplant. And there was a thought that the graft versus leukemia effect would be able to overcome the reduced intensity conditioning. So you're using less toxic chemotherapy or radiation before the transplant, and that would reduce the transplant-related mortality, but then you infuse the allogeneic cells and you have this robust graft versus leukemia effect, which we believed would improve overall survival. So we did a randomized trial comparing high-dose intensity conditioning regimen to low-dose intensity conditioning regimen, and we showed that actually conditioning intensity is important. And if you do lower the conditioning intensity, it does increase significantly the relapse rates of patients with AML or MDS.